Hello everyone. Let's begin with the OB-GYN recall. So let's start with the question number one, guys. So before starting the question number one, guys, the language of the questions cannot be exactly same that has been asked in the exams, but still somehow with the help of the students, I try to make the best possible recall for the obstetrics and gynecology. So let's begin with the question number one. What will be the management of the anemia in a pregnant lady with the hemoglobin of 10 grams in second trimester as per the Anemia Mukt Bharat program? So guys, we all know this Anemia Mukt Bharat program, this strategy was implemented to reduce the anemia. Okay, this strategy was implemented to reduce the anemia. And as per this, guys, we have already discussed in our rapid revision session the same question, guys. As per the Anemia Mukt Bharat, if I talk about pregnancy and lactation, the amount of iron to be given to a pregnant lady is 60 mg and amount of folic acid to be given is 500 micrograms daily. Okay, we have already discussed the question. So the answer to this question is, guys, 60 mg iron and 500 micrograms folic acid once a day. Okay, and if the question would have been asked generally, not as per the Anemia Mukt Bharat, then the answer would have been C, 100 mg iron and 500 micrograms folic acid once a day. And if there would have been a mild to moderate anemia, then we can go up to 200 mg iron per day. So guys, the answer to this question is A. Let's move to the second question, guys. What is the gold standard investigation for the endometriosis? Okay, so guys, we have discussed again in the rapid revision and the main classes as well that endometriosis, the investigation of choice is the laparoscopy. The investigation of choice is the laparoscopy. So let's discuss a bit endometriosis, so it will be helpful for the other students as well. So endometriosis, guys, we have discussed it's due to the retrograde menstruation. What is the etiology, guys? It's due to the retrograde menstruation. What is retrograde menstruation, guys? It's backflow of the menses, and 70 to 80% of females have this retrograde menses. But what happens, the patient having a good immunity or the females having a strong immunity, they don't develop this endometriosis, and the people having weak immunity, they develop this endometriosis. The classical symptoms will be, guys, the patient will complaining of dysmenorrhea, patient will complaining of dysmenorrhea, and rarely patient can complain of infertility. That rarely the patient will complaining of infertility. Okay, and the investigation of choice is, guys, laparoscopy. Okay, the same condition, guys, some people were saying that HPE was also mentioned. HPE will be the gold standard of investigation for adenomyosis. Remember that adenomyosis, gold standard investigation will be HPE. The investigation of choice over there will be MRI. Is that okay, guys? And the treatment of endometriosis, if I discuss, guys, the treatment is what? Anti-estrogens. We give danazol. We give danazol as a treatment because that will do the atrophy of the endometrium. And we also use injection depot medroxyprogesterone acetate. Okay, these are the treatment for the endometriosis, guys. So simple question we have discussed in the class. The best investigation of choice is laparoscopy, and the most common site is ovary. So next time they can also ask the pathological findings, guys. There are powdered burn lesions or the chocolate cyst. Again, a PYQ was asked, guys. The last time from the endometriosis, they asked what is the treatment of the cyst, recurrent cyst. At that time, I have mentioned already cystectomy. But this time, simple question, guys, investigation of choice, that is laparoscopy. Next question, guys, uterine inversion management was asked. Okay, guys, we have also discussed in our main classes, guys, uterine inversion management. So what will be the, first of all, what will be the causes of this uterine inversion? When we have an adherent placenta. When we have this adherent placenta. What is uterine inversion actually? It is a turning inside of the fundus into the cavity. Okay, guys. So what is the most probable causes can be the adherent placenta. What I mean by this adherent placenta, guys, by adherent placenta, I mean when the neta bush layer is absent. If this is the uterus, guys, this is the placenta attached here. So this layer here, it's a fibrinoid layer that helps the smooth separation of the placenta. And when this fibrinoid layer or the neta bush layer is absent, we call it as adherent placenta. And when this adherent placenta we try to take out, guys, it can cause uterine inversion, or the forceful extraction of the placenta, or the fundus implantation of the placenta. These can all be the causes of what? Uterine inversion. Then I mentioned, guys, patient goes first into the neurogenic shock followed by the hemorrhagic shock, and the most common cause of death will be a hemorrhagic shock. Then, guys, if I talk about the first treatment, guys, first of all, you have to resuscitate the patient. Of course, resuscitate the patient, get the IV access, and then you have to reposit the uterus with as soon as possible. Manual reposition of the uterus, and this manual reposition of the uterus is called as Johnson's maneuver. So your treat first, will be here, guys. From the notes, I'm marking it manual reposition called as Johnson's maneuver. Then further, guys, we'll give injection terbutaline to relax the uterus. Okay. And we also go for the hydrostatic reposition, O'Sullivan method. These are the other conditions, but the uterine management here, the possible answer will be first manual replacement of the uterus. Sorry, manual reposition of the uterus. Okay, called as which maneuver? Johnson's maneuver, called as Johnson's maneuver. Okay. Next question, guys. In a 22 weeks of old primary gravida, USG shows the marginal placenta. What is the next management? So the next step. So pregnant lady is coming to you at 22 weeks. That means the second trimester. Okay. And now USG shows the low-lying placenta, marginal placenta. So the next step will be, guys, we have to assess the again at 32 weeks. You will reassess with the USG at 32 weeks because most of the females at third trimester, this placenta can go upwards. Okay, guys. So it can go upwards, it can go back. So you have to reassess again at 32 weeks. If not at 32 weeks, then further you will go at 36 weeks. And based upon the position at that time, guys, we have a particular management discussed in our main notes and main classes, guys. So if you have a low-lying placenta, I have mentioned, what do I mean by this low-lying placenta, guys? It's a placenta 2 centimeters away from the os. So first of all, if at 37 weeks, you will go for a normal vaginal delivery, trial of an NVD for a low-lying placenta. Again, for the complete placenta preview at 37 weeks, you will go with what? You will go with the cesarean section. But for low lying, you will go first trial of a normal vaginal delivery. And if it's not possible, you go with the cesarean section. And before 37 weeks, if asked before 37 weeks, guys, less than 37 weeks, you go with the regime called as McFay-Johnson regime. You go with the McFay-Johnson regime. Okay, you admit the patient, give the steroids, arrange the blood, and if Rh negative, give anti-D, and that's called as McFay-Johnson regime. So for the low-lying placenta, you have to reassess at 32 weeks, then followed at 36 weeks, and then according to that, you'll go with the management. Done, guys? Screening of diabetes in pregnancy, what will be the oral glucose load? Okay, guys. So it's a question from a gestational diabetes. Okay, guys. So GDM. So we already know, guys, GDM occurs after 24 weeks of the pregnancy. And after 24 weeks of the pregnancy, guys, what happens? HPL, human placental lactogen, and estrogen, they have an insulin-like action. Okay. And when they have an insulin-like action, they further increases the blood sugar levels. Okay. Then the test that we go for OGTT, guys, screening. So screening for GADM after 24 weeks, we go with the one-step test. Okay. And also we go with the 75 grams of sugar, and we calculate the levels at 1 hour and 2 hour, and any one of the above will be the confirmatory of the GDM. We have discussed in our main classes, guys, again directly from the notes. So what will be the answer here, guys? How much of sugar we are using? 75 grams of sugar. Then later on, let me write down the treatment as well. The treatment for GDM will be, guys, insulin will be the treatment, insulin regular. And if I talk about the oral hypoglycemics, the drugs that we use is metformin and glyburide. The metformin and glyburide, biguanides and sulfonyl urease. Next question, guys. So the answer to this question is B, 75 grams. Then an 80-year-old elderly woman complaints of involuntary urine voiding during the strenuous physical activity. What will be the diagnosis? Okay, guys. Same question we have discussed in our rapid revision, guys. A 55-year-old lady with 5 children present with a leakage of urine on cuffing. On examination, there is a second-degree uterine prolapse and cystocele. What is your mostly likely urinary abnormality? So it's a case of a stress incontinence. Okay, guys, it's a case of a stress incontinence. Already, guys, we have discussed it. So this is a case of a stress incontinence. This stress incontinence, the most common cause, guys, mainly it occurs when there is a bladder neck descent. Okay, when there is a bladder neck descent, and this bladder neck descent in the elderly women, it's due to the uterine prolapse. Okay, when there is an uterine prolapse, it will involve what, guys? It will involve cystocele and rectocele. That means it will involve bladder and the rectum, giving the symptoms of the cystocele and rectocele. Okay, and I have already discussed that after there is a bladder neck descent, so there are the features of cystocele. Okay, and then the treatment for that at that time, we go for the anterior colporrhaphy. We try to pull it back. It's descending down. We try to pull the bladder. We try to pull the anterior side and tighten. This procedure is called as anterior colporrhaphy. And for the rectocele, we go for the posterior colporrhaphy. Okay. So we have discussed, guys, this is a leakage of urine coincides with the stress called as stress incontinence or escape of the urine. There is no prior urge to void because of the complication of the anterior colporrhaphy as well. Okay, when we try to tie the anterior vaginal wall, guys, if it's not done properly, patient can complaining of the stress incontinence, and the patient is fully aware. The treatment will be tension vaginal tape. Also, we go for the bladder neck plication because the bladder neck descent is there, so we also go for bladder neck plication. But the best treatment, if asked, guys, it's always TVT. So this question we have also discussed in our rapid revision, guys. We have also discussed in our rapid revision. Okay, so the answer to this question is stress incontinence A. Next question, guys. A pregnant woman after lunch feels like fainting while lying down, but gets better when she lies laterally, sting turning to the side. Diagnosis. So, guys, again from the test and discussion, we have discussed the same question. A 25-year-old primary gravid at 38 weeks gestation present to the antenatal clinic with the complaints of faintness on lying down for the past 1 week. She feels better when she turns to a side and while in sitting position. What is reason for her symptoms? So the reason is, guys, inferior vena cava compression. So what happens when this uterus, guys, it compresses the IVC and it further decreases the venous return, and that further decreases the cardiac output. And when the cardiac output decreases, guys, patient is having hypotension and the symptoms like lightheadedness, hypotension, tachycardia, syncope. And the reason for this is, guys, IVC compression. What is the reason for this? IVC compression. And that's why we advise the patient to lie on the left lateral side. What do you advise the patient, guys? Lie on the left lateral side, so she will feel better. Is that okay? So answer to this question, again, we have discussed all the questions that have been asked in the exams. Out of 30 questions, 22 are directly from the rapid revision and my main notes. Okay, I have attached multiple screenshots over there, guys. You can look IVC compression. Then for a woman with a mental retardation, who gives the consent for medical termination of the pregnancy? So, guys, for the normal ladies, the female herself will give the consent for the MTP. But if she's less than 18 or mentally retarded, guys, then the consent will be given by the legal guardian. A female presented to the gynecologist with genital infection. In which of the following conditions male partner treatment is also required? Okay, guys, so it's trichomoniasis. I have marked over there as well. Drug of choice was metronidazole, and main important part was, out of these 3 vaginites, whether it's trichomoniasis, it's candidiasis, or it's bacterial vaginosis, the treatment for the partner as well is in which case, guys? Trichomoniasis. And we have a strawberry vagina, which is also called as colpites macularis. And one more thing I've mentioned, guys, the discharge, it's frothy or the greenish discharge over there. And clue cells can also be positive, or whiff tests can also be positive in trichomoniasis. So partner treatment is also required on which condition, guys? Trichomoniasis. Again, simple question, guys. A pregnant female with asthma presents with hypertension. Drugs used are. So, guys, I've discussed not exactly same question, but related to that in our rapid revision. A 35-year-old woman is a chronic hypertensive. She visits the clinic for the pre-conception counseling. Which of the following antihypertensive needs to be stopped prior to the conception? So we know, guys, the drugs that we generally use in the pregnancy are labetalol, alpha-methyl dopa, nifedipine, prazosin, hydralazine. But, guys, ACE inhibitors are contraindicated because we know that they have a side effect of bilateral artery stenosis, and further they can cause the decrease in the urine formation and oligohydramnios and all we have discussed in our main classes. But you all know that beta blockers are contraindicated in asthma. So what will be your further choice, guys? IV labetalol, it's a alpha plus beta blocker, you cannot give, guys. Oral labetalol, you cannot give, guys. ACE inhibitors are already contraindicated, guys. So the answer here will be oral nifedipine, calcium channel blocker. Okay, guys. So the answer here is oral nifedipine. And, guys, one more thing about the hypertension I've already discussed. It occurs more than 20 weeks when the blood pressure is more than 140/90 on 2 occasions. on 2 occasions 6 hours apart. And simple line में यार, just remember the pathophysiology due to the incomplete trophoblastic invasion. Due to the incomplete trophoblastic invasion. Because the high arteries are not replaced with the low arteries, which further results in the high resistance in the arteries, and patient is having pregnancy induced hypertension. Okay, so the simple question, guys, oral nifedipine. An adolescent female presents with a delayed puberty with the primary amenorrhea with short stature. Which of the following is not seen? So we have discussed it multiple times, guys, even in the amenorrhea and also in the gonadal dysgenesis. Okay, so guys, short stature, webbed neck, wide space nipples, directly classical case of a Turner syndrome. Directly classical case of a Turner syndrome. And which of the following is not seen in Turner syndrome, guys? Webbed neck is there, cubitus valgus is there, bicuspid aortic valve, mitral valve involvement is there, but mental retardation is not in case of a Turner's syndrome, guys. We have discussed these things, guys. Webbed neck, short stature, cubitus valgus, shield chest, trigonads, primary amenorrhea, bicuspid aortic stenosis, but the IQ is normal. Patient is not having a mental retardation. So there were 2 questions on Turner syndrome, direct cross cut, guys. I hope every one of you marked it right. Amsel's criteria is used for, guys. So the most it's used in the vaginites, but most common vaginites, which one, guys? Bacterial vaginosis. So we have discussed, guys, vaginites, bacterial vaginosis is the most common one, guys, and the criteria which is used is called as Amsel's criteria. More than out of 4, 3 should be required for the diagnosis. That means clue cells, creamy discharge, fishy odor, and whiff test positive. So guys, simple question. Amsel's criteria used for bacterial vaginosis, in which partner is treated, which one? Trichomoniasis. And curdy discharge, I have also some queries that candidiasis was also asked with the curdy discharge and all. So that will go with the candidiasis. One more question on this Turner syndrome. An adolescent female presents with a delayed puberty with a primary amenorrhea with short stature. Again, on further evaluation, she is found to have absence of Y chromosome, but the presence of X chromosome and karyotyping. Which of the following is also seen in this condition? So it's a classical case of a Turner syndrome. And out of which of the following feature will be present in this Turner syndrome, guys? Webbed neck is the answer. I know, guys, language of the question is not exactly same, but questions were asked like moreover 60 to 70% language can match. Okay, so webbed neck was the answer for Turner syndrome. Which is the most common organ infected with genital tuberculosis? So if I talk about genital tuberculosis, most common organ which is involved is fallopian tube, and most common in fallopian tube, which part is that? Ampulla, guys. Same as per ectopic pregnancy, most common fallopian tube, most common site in fallopian tube, ampulla. If I talk about ovary and endometrium, guys, these two are secondary infections. Then secondary infection can go with the direct spread to ovaries and endometrium, but the most common will be fallopian tube. Most common will be fallopian tube. If I talk about most common symptom, of genital TB, it's infertility. The most common symptom will be infertility. So answer to this question, guys, most common organ is fallopian tube, B. What is the ideal time to check for nuchal translucency to diagnose the aneuploidy, guys? Simple question, 11 to 13 weeks. Also, we have discussed in our rapid revision, estimation of fetal age, nuchal translucency, and the fundal height as per the weeks. Okay, so guys, 11 to 13 weeks, we go for the nuchal translucency, and amniocentesis, we go 16 to 18 weeks. So answer is A, 11 to 13 weeks. According to the WHO 2021, which of the following is not true about the normal sperm analysis? If we talk about the infertility, guys, in main infertility, when I discuss the semen analysis, I've mentioned the 2 charts over there, WHO 2010, and then revised it to 2021. The only differences are that, guys, the total mortality of sperms is now 40 to 42%. And if I talk about progressive mortality, guys, that is around 38. So the answer to this question is total mortality of sperms. That is not true. It should be around 40 to 42 now. Is that clear, guys? So according to WHO 2021, the semen analysis should be how much, guys? More than 40 or more than 42%. What is the POPQ classification of reference points? POPQ classification we use for the prolapse of uterus. We have one more classification over there, prolapse of uterus. We used to discuss before Shaw's classification. Shaw's classification, but they asked that what is the reference point in the POPQ classification? The reference point is, guys, hymen. If I talk about ischial spine, this is a reference point when we check the station of the labor. That means this ischial spine is the narrowest inlet. Then taking this as a reference point, we can say what is the current station. Okay, it's +1 or -1 or at 0. So that's known to us as the labor. Okay, so POPQ classification, the answer will be A, hymen. A primary gravida present to the emergency department at 1 p.m. with 5 centimeter dilatation. When PV repeated at 4 p.m., she is 6 centimeter dilated. Next step to do is, so we all know, guys, we have two phases, latent phase and active phase. So more than 4 centimeter dilatation, more than 5 centimeter dilatation as per new rules is which phase, guys? Active phase of labor. And in active phase of labor, guys, it's said to be that there should be 1 centimeter per 1 hour dilatation. But when the PV was repeated at 4 p.m., after 3 hours, she was just 1 centimeter more dilated. That means what will be our next step, guys? Wait for the complete dilatation? No, guys, she's already having a prolonged labor. We induce the labor. Rather inducing the labor, we can go for the augmentation of the labor because she's already in the labor. So you cannot induce the labor. So intervention to be done will be the answer here. You have to intervene it. Okay, guys. And some students were saying options were ARM plus oxytocin, then check after 4 hours. Yes, you can go for the artificial rupture of membranes as well, so that they will release the prostaglandins and they will induce the labor. Also oxytocin. But as per these three options, intervention to be done will be the correct answer. According to the MTP Act, which of the following statement is offendable or punishable? Or punishable. So termination of pregnancy at 24 weeks. Yes, as per the MTP Act 2021, we can go up to 24 weeks. Termination of pregnancy at government hospitals. Yes, we can do MTP in the government hospitals. Termination of the pregnancy by registered medical practitioner. Yes, one who is having a 1 year of experience in these and have done 25 MTPs. Yes, non-recordable in monthly outcomes. Guys, this will be the punishable, guys. Okay, so the answer is D. You have to register every MTP that you've done in the higher authorities. Okay, guys. CMOs and all. Okay, guys. So answer to this is D. Wife of a truck driver belongs to low socioeconomic status, presents to the gynae OPD to rule out the cancer cervix. What is recommended screening method? So guys, for screening, guys, what is the best, guys? Pap smear, and we do it with the help of Aries spatula. So Pap smear, you will go with the, guys. Then CA125 levels, you check further. Colposcopy biopsy, when you have CIN2 and CIN3, then only you will go with what, guys? You will go with the biopsy with the help of a Lugol's iodine or acetic acid. Okay, because this is a classification called as Bethesda classification. I mentioned in my classes, CIN1, when the less than 1/3 cells are abnormal. So at this stage, CIN1, you will just go for the screening test, pap smear, and advise patient antibiotics and antivirals. Okay, but when more than 1/3 cells start getting abnormal, guys, so you start with the colposcopic biopsy with the help of a Lugol's iodine or with the help of acetic acid. Then you take the biopsy from these areas and get further evaluate the patient. Okay, so for a screening, guys, you go with the pap smear. Some people were saying VIA, some are saying VIA was not in the option. So guys, my side answer will be pap smear as the best one. Okay, what is the investigation of choice of ovarian torsion, guys? USG Doppler will be the investigation of choice for ovarian torsion. What is the correct sequence of lactation? So guys, correct sequence for the lactations will be, first of all, there will be the breast development, guys, which will be the help of estrogen and progesterone. Then there will be the lactogenesis, guys, synthesis of the milk. Okay, then with the help of a prolactin. Then there will be galactokinesis with the help of an oxytocin. There will be ejection of the milk. Then the maintenance of this lactation is called as galactopoiesis. Okay, before they used to ask which hormone is responsible for the lactogenesis, which hormone is responsible for galactokinesis. This time they ask the sequence of the lactation. So the answer is mammogenesis, lactogenesis, galactokinesis, and galactopoiesis. Maternal, next question, maternal, which part is attached to the placenta? So guys, placenta has two parts, fetal part and maternal part. If I talk about fetal part, guys, fetal part is attached to chorion frondosum. Chorion frondosum. And maternal part is attached with decidua basalis. So maternal part is attached to decidua basalis or formed by decidua basalis. And this is formed by chorion frondosum. Is that okay, guys? This is the bigger part and this is the smallest part. And this this decidua basalis along with the decidua parietals gives a sign that we discuss in our ectopic pregnancy chapter called as double decidual sign, which indicates there is an intrauterine pregnancy. There is an intrauterine pregnancy. So answer to this part is simple question, guys. Decidua basalis. If RH negative pregnant female after performing chorionic villus sampling. This was the main catch, guys. Performing chorionic villus sampling. Dose of anti-D given is. So we know, guys, anti-D is given when there are complications. Okay, so complications can be erythroblastosis fetalis and as well as hydrops fetalis. So anti-D is given so that there will be no complication in the next pregnancy, because first pregnancy is always safe, then the antibody antigen reaction will be in the second pregnancy. So to prevent those reactions, to prevent those complications, we give what, guys? Anti-D. But I have mentioned, guys, I have mentioned that if less than 12 weeks you give 30 micrograms, if more than 12 weeks you give 300 micrograms. But the main catch was, guys, also they have asked this question before. Chorionic villus sampling is done 11 to 13 weeks. Okay, guys. So simply the question was female dose anti-D given is. So it usually less than 12 weeks chorionic villus sampling is done, and the answer will be, guys, 30 micrograms. It will be 30, guys. 30 micrograms. If 30 was in option 30, 50. Okay, not 300. There was only confusion between two options, 30 or 300 or 50 or 300. Then the answer will be, guys, B part. Okay, 300 micrograms is given when it's more than 12 weeks, and with the help of which test, guys, we use Kelly-Hart-Bedke test, which is called as quantitative test, Okay, guys, so here answer is B, 30 micrograms. A 25-year-old lady came to the OPD with unprotected sex after the 5th days. What is the likely contraception suggested? So the contraception suggested at the 5th days will be IUCDs, guys, because they are having a highest efficacy. Now some queries were, guys, sir, ulipristol was also mentioned in this case. Ulipristol is, guys, selective progesterone receptor modulator. Is used up to 5 days. Yes, it's used up to 5 days. But if you have to choose between these two, IUCD and ulipristol, you will obviously go with the IUCD because they're having a highest efficacy at that point. Okay, so the answer is D, IUCD. I mentioned used up to 5 days, and they are with the highest efficacy in our main notes in the chapter of contraception. So IUDs used up to 5 days and having a highest efficacy. Then the next question is, guys, Mac Roberts failed in shoulder dystocia. What is the next step and the management? So if I talk about, guys, Mac Roberts maneuver, we usually use when we have obstructed labor, and more our chances are in when the baby is macrosomic more than 4 kg. When the babies, and usually which condition, guys? Gestational diabetes mellitus. We have a macrosomic baby. So after performing the shoulder dystocia, I've mentioned, guys, first of all, you call for the help. Second will be, guys, you go with the episiotomy. You go for the plan incision. Then you will go with the legs maneuver, or you will go with the Mac Roberts maneuver. And further, the next part will be suprapubic pressure. Suprapubic pressure. So next step will be, guys, suprapubic pressure after the Mac Roberts maneuver. These are the also other maneuvers used in conditions, but the question was saying after the Mac Roberts maneuver is performed, what is the next step? So next step will be suprapubic pressure. And in the next time, if they can ask the question, and the most common nerve injured in this case is what, guys? Lateral cutaneous nerve of thigh. Lateral cutaneous nerve of thigh is injured in Mac Roberts maneuver. A 2-month pregnant female present with the Plasmodium vivax malaria, preferred drug used for this treatment in case will be, guys, we have discussed malaria in the pregnancy. First trimester, the drug always is quinine. So what will be the answer, guys? The answer will be quinine. First trimester, drug of choice for all trimesters. Sorry, drug of choice will be quinine for the first trimester. What is the management of the following condition in the pregnancy, guys? So this is genital warts, condyloma acuminata, okay, caused by HPV 6 and 11. So the treatment for this, guys, I have discussed viral infections, guys, anogenital warts, condyloma acuminata. The treatment in pregnancy will be cryotherapy or TCA. So, guys, answer here will be, guys, cryotherapy. Option C. Okay, guys. So that was all about OB-GYN. Recall, guys, as many as questions I got, I posted them. There will be a change in the language and of the options, but I hope every one of you will pass the exam, guys. Stay relaxed. And remember, guys, you never lose. Either you win or you learn. Okay. So good luck for the results, guys. I hope this will be useful for you guys. Thank you.